Hi, Maria Rebozo Lapine. Welcome to our Cafecito Time con Equality Health Studio. You know, I don't normally like to start my segment with stats, but I found one that was impressive. 16.5% of U.S. children between the ages of 6 and 17 have at least one treatable mental health disorder. That's like anxiety or depression or ADHD. Now, it doesn't seem like a lot when we look at 16%. But when that 16% means 7.7 million children, wow, that's an impact. When I saw that, I knew I had to have a segment on mental health and our children. And I reached out to Maria Bayon. Maria Bayon is a community relations and patient engagement with Jewish Family and Children's Services. Maria, first of all, you have an amazing name.
Thank you.
Thank you for being here with us today. Those numbers are scary. And that's why I wanted to have you here today. But before we get started, I want them to know a little bit about you and how you got to that organization. So tell me a little bit.
Yes, I have a little bit of a background as a health coach, and I work with chronic disease prevention in public health. And then I realized how important mental health is in our, disease prevention as adults, and the repercussions that childhood has in the adult. So I'm working with Jewish Family and Children's Services. We do serve everybody, people from all backgrounds, all faiths. We are a nonprofit, non-sectarian organization, and we've been around since the Great Depression. It started with a group of women in their community, helping their neighborhoods, and then we expanded nationally. So we are, nationally helping families and kids to have a more peaceful and healthy life.
So you help from newborns all the way to adults.
All the way to adult.
And what are some of the services that you offer?
We have behavioral health services, and we have social services, and we also have, lately, we added a physician primary care services in each clinic. And primary care services work together with behavioral health, and that's what we're calling integrated healthcare.
And that's why I invited you, because her organization aligns with what Equality Health is doing. That word integrated, where you integrate, it means that behavioral health and mental health and pain management is all taken care of in one place. That's really what integrated health means. So thank you for being here today. I want to get started right away. Yes. 10 minutes is not enough for our topic of today.
I know.
First of all, I want to give the audience some examples of what mental health is in children. Like, what could it be? Because I think a lot of us think that we're going crazy, or we think of that person that's on the corner of the street that's talking by themselves, or maybe someone who wants to cause harm to themselves.
Yes.
But
yes.
It can be...
The spectrum is big.
Yes.
Right?
So can you tell us a little bit more about that?
Yes. It could be, that our kids need help with, things that for us will be normal, like, moving to a new school, or I don't know, maybe like the death of a pet, or, just changes, in our lives. Sometimes kids have a hard time, communicating their emotions and talking about them. So what other changes could be?
Well, I know that when you and I were talking behind the scenes here, you mentioned that maybe incarcerated, maybe someone, one of the parents is in jail, or maybe they have to go out of town to work, or maybe the parents are losing the home.
Yes, that's a big one. There's a screening tool. It's called the ACEs, Adverse Childhood Experiences. It's a screening tool that was developed by the CDC, and it's just like 5 or 6 questions, and adults can take it too. It's out there. It's free, but it talks about the effects of children that have it over time, and so children that have a parent that has been incarcerated, or a parent that is seriously mentally ill, or a child that lives in an environment under domestic violence, or just physical abuse and neglect. Those are situations where if the environment is in that under that, we need to look for help.
I was reading, when I was preparing for this segment, I was reading that when there's a death, maybe of a parent or even a grandparent, even infants can suffer that loss. So I was amazed. So thank you for sharing that with us. So the second question that I have for you is, now that we know some of the things, some of the issues, what are some of the symptoms? How do these children show, that they're struggling with depression or anxiety or things like that?
Yes. One of the things that we can look out for, like as a parent, is the attitude of the child. Like if a child is defiant, sometimes it's a way of them to ask for help. We need to always stay in communication with, because things that are happening inside the house can also be happening outside. So with school, a staff, with the teachers, to see, how things are going there too. Speak to our pediatrician about, the worries that we have, about our kids' defiant attitudes. If it's if the kid is defiant for like little things, that really are not worth all that, anger, that's a red flag, something we should be looking out for. Another one is sudden shifts in their habits, like sleep patterns. Maybe they're having recurrent nightmares, or they're not eating. That's the pretty obvious. You can tell that they're not eating as much as they used to, or they're eating a lot more. Eat changes in the habits. Another one was excessive worrying and anxiety. So it's okay to worry. Worry is part of life, but if it's excessive and it's consuming, a lot of their energy and, their days, then that's something to look out for.
And I'm glad that you added that, because one of those examples is also getting a divorce. Mm-hmm. And I can tell you, I'm going to share my experience. When I got my divorce, my children were 6 and 8 years old. And my 6-year-old got anxiety. He was scared. He was scared because his dad was no longer in the house, so he didn't feel safe.
Yeah.
And so I'm so glad that he was able to tell me what was worrying him, and I was able to help him. But sometimes they don't express it with words, right? They express it with maybe drawings or play.
Mm-hmm. Or isolation too. Like they maybe they were really outgoing, and then now they don't want to leave the house. They don't want to have play dates. They don't, they just want to be on their own, have lunch by themselves in school. That's another one too. And then lastly, the obvious one is if they, tell you that they want to hurt themselves, or, they want to hurt another person or a sibling. That's another thing, another situation that needs to be addressed right away. And, you
addressed right away and with a professional.
Exactly, mm-hmm. Yes.
Mm-hmm. So as a parent, how can I help my child?
Well, there's, different ways of addressing it. Keeping an open communication, being present, listening. And one of the things we were talking about was to look, if there's a child that has many siblings, look for that one-on-one, moment to address, your concerns, with the child directly, Look for, help also, counseling services. It's a great way. And again, you can talk to the pediatrician of the child to let them know. They're usually a great resource, and they'll guide you. They point you in the right direction to see how bad is it, really.
Or how good it is.
Or how good,
it might not always be that bad.
Yes.
I know that you thank you for sharing that, to talk to the pediatrician. I know it's important. We have to do it. We have to share not only what's going on with our health, not only the vaccine and the flu shot and the immunizations and things like that, but we also need to share what's going on at home, because our pediatricians are a great resource for resources in the community and to guide us. And you had mentioned to me that these services do not cost anything for people who have Medicaid.
Exactly. Yes, we do take Medicaid in all of our clinics, and that is a service covered by Medicaid. Yes.
So you see, no reason not to. Mm-hmm. Now, another thing that you had mentioned to me was that if you're not happy with the provider that you have, you're not stuck with that provider.
Exactly, yes. You can kind of shop around to see who you connect or your child connects with better. That's don't get discouraged if you don't find the first person to be the perfect person.
Well, I'm glad that you said that, because like me, I would think that I'm stuck with that professional or with that provider. And no, we need to find someone that we trust and we feel safe with. Thank you so much. I want to thank you
you.
for being here at our segment. I know you had more information.
So much more to share.
I know, but I promise I'm going to have a Cafecito 2.0 and I'm going to invite you back so that we can continue this conversation because I know it's very important and I know we just barely touched the topic.
Yes.
So thank you.
Self-care for parents was the last one too.
Oh, good. I'm glad that you added
Yes.
that. Yes, because if we're not healthy, we can't help them.
Exactly.
Thank you.
Thank you.
Parents, you know your children best. Talk to your providers if you are worried about the way they're behaving at home, at school, or with friends. And like she said, seeking these services are at no cost for those of us who have Medicare and Medicaid. So reach out. If you have any questions, please put it on the comments. I will answer all questions. And make sure to subscribe so that you know when the next Cafecito video is ready to be viewed. Cheers to your good health.
Cheers.